Are you having neck pain on the side of your neck here? Maybe it radiates up behind your ear, it comes down maybe to your collarbone here, it comes down your arm, your hand, your fingers. You may even find that it radiates to the jaw, maybe behind the eye, can mimic a headache. So you could be having a spasming or tenderness and referral pain from the SCM muscle, also known as a sternocleidomastoid. So we have two of these muscles. There's one on each side of our neck right here. And the sternocleidomastoid, or SCM, is a contralateral rotator, so it rotates you to the opposite side, and an ipsilateral flexor, so same side flexion. So the contralateral rotation is going to be this. On the left side here, when this muscle contracts, it rotates my head away to the opposite direction, to the right. When this muscle contracts for ipsilateral, or same side lateral flexion, it's going to contract and my head goes to the left side, the same side that the muscle is on. Now this muscle can become irritated from straining, repetitive movement, whiplash injuries. You could have just kind of slept incorrectly, or for whatever reason it just spasms and becomes tight, and that can cause all these symptoms coming down. So I'm going to show you 3 techniques that you can do to try to reduce your pain and improve your mobility. The first technique is going to be a soft tissue technique, and I'm going to combine 2 things in one with this. So what you're going to do to find your SCM, I'm going to try to locate mine on the left side here. So I'm going to turn my head to the right, put my right hand on my forehead and push my head forwards, like right now towards the camera, and that muscle is going to pop up here and I can feel that. And then after I feel it pop up, I'm going to bring my head back to neutral and midline so I can take a hold of it here. It's on slack. And I'm either going to do one of 2 things. I'm either going to perform like a stroking movement, taking my thumb and stroking all the way up behind my ear and then all the way down to my collarbone or clavicle here and sternum area. Just kind of go back and forth. Maybe I spend 3 to 5 minutes doing that. I can also take like a pincer grip, and I can kind of squeeze it. And I'm just kind of mashing, not super hard, but a little bit, kind of those spots like you get between the shoulder blades that hurt so good kind of thing. And I'm just going to squeeze and work my way all the way up, just kind of pinching that muscle to try to get a little bit of release or tone modulation. Isometric contractions. A lot of times if we can, click on and click off the muscle with isometrics or with some sort of resisted contraction, we can get the tone. We can get the muscle to kind of relax or to calm down its pain signal that's going on. So I'm going to show you just a lateral flexion. So this is the left side, right? So remember, when that contracts, it pulls my head that way. I'm going to take my left hand, or you can take your right hand. If your left hand is numb and it's hurting from this, then use the other hand. But I'm just going to take my left hand and I'm going to push into it. So I'm pushing into my hand. I'm holding this, 3 to 5 seconds, and maybe I'm only putting out 10 to 15%, just a little bit. And I'll work my way over all the way to bring my ear closer to my shoulder. And I probably would do that I may perform 10 repetitions, a few sets, or maybe I just sit there and spend a minute or 2 just doing that, kind of working that back and forth. That's a great technique to do, not only to try to build a little strength up, but mostly to try to reduce that tone that's going on, as well as modulate or decrease the pain. And then lastly, the thing that you can do is apply a heating pad or moist heat. Now you want to make sure, again, that your skin integrity and all that is where you can tolerate a heating pad and just putting that heat on. I hope this video helps, guys, and thank you so much for watching.